Hello, welcome to Walk, Don't Run to the Doctor with Miles Hassell, MD. This is an evidence-based podcast for people who want to use lifestyle choices to avoid preventable illness, as well as to treat illness. Listeners will learn the choices that work for better health outcomes for themselves, the ones that they love, and the patients they care for. We want to see patients liberated from the burden of chronic disease whenever possible. Hello, I'm Miles Hassell. I'm a physician at St. Vincent Hospital in Portland, Oregon, and this is the podcast Walk, Don't Run to the Doctor, where we talk about things that will minimize your interaction with health professionals, but not anti-health professionals. In other words, we want you to be so healthy that you actually don't need people like me very often. The website that gives a lot of background to what we're going to be talking about today is greatmed.org. Greatmed.org has references and more material than we're going to cover today. And the book that my sister and I wrote, it's in its 4th edition now, and it's called Good Food, Great Medicine. It's available widely. So we're going to talk about we're going to talk about some of the things, and we're going to nail it down to 5 things, for examples, that you can do to help prevent and reverse type 2 diabetes and prediabetes. And for some people, diabetes is kind of this vague concept. They know blood sugar is high. They know you take medicines for it. You know, it's just something you do. What is often forgotten is that diabetes left unchecked, even in its treated state. In other words, even when you treat diabetes, you're still, with medicines, even when you treat type 2 diabetes with medicines, you're still at higher risk of things like stroke and heart attack and neuropathies and going blind, kidney failure. And these aren't, it sounds kind of dramatic when you put it that way. These are actually not exaggerations. These are things that we see in my internal medicine practice literally every day. And so in terms of using lifestyle to prevent and reverse type 2 diabetes and prediabetes, we like to think that it's also giving the patient liberty. Liberty not just from complications of the disease, but liberty from so many doctor's visits, from checking your blood sugar, from side effects of medications, from the cost of all this. So it's not just about improving your health, it's also improving your quality of life, of reducing unnecessary suffering. And reducing unnecessary suffering is really what is the foundational, one of the foundational aspects to what greatmed.org is about. So, you may be a clinician, a physician, you may be a patient, or you may be somebody who's perfectly healthy who knows somebody with prediabetes or type 2 diabetes. And this is for all of you, because we can point other people to making these good decisions. Because the decisions you need to make, or anybody needs to make to prevent or reverse prediabetes or type 2 diabetes, these are all essentially free. And all they take is a change between the ears, I would submit. A change in attitude, a change in expectations, a change in planning. While we're still on this subject, it's worth mentioning that prediabetes is associated with a lot of the same risks of type 2 diabetes. So just because you have prediabetes doesn't mean that you're home clear until you turn into somebody with type 2 diabetes. These distinctions are arbitrary and not entirely supported by the available evidence. And so by that I mean somebody with prediabetes is also at higher risk of heart attack, stroke, and neuropathies and eye damage and so on, just not to the same degree as somebody who has frank type 2 diabetes. And so we sort of think that prediabetes is a bit of not quite a fraudulent diagnosis, but it can be a misleading diagnosis if you don't realize that it's also associated with higher risk. So we're going to arbitrarily, speaking of being arbitrary, split our recommendations into 5 categories. One is food quality. The second is food quantity. The third is physical activity. The 4th is getting your mind on board, sort of making all this matter, making it a priority. And 5 is consider the alternatives, which won't take very long. So far, the evidence for type 2 diabetes and prediabetes reversal and prevention in the context of also preventing diseases like heart attacks and strokes and so on appears to be the evidence appears to be strongest in terms of food choices to be a Mediterranean diet pattern. And this is something that's explored a lot on greatmed.org, the website, as well as the book Good Food, Great Medicine is all about this. And the Mediterranean diet pattern is a vegetable and fruit heavy, includes beans and grains, includes animal proteins like dairy, includes moderate fat, butter, cheese, eggs, olive oil, especially olive oil, and typically in most studies includes modest amounts of alcohol, especially red wine. And so this omnivorous whole food diet pattern so far is the one best supported. Is it the only game in town? Probably not. It's very likely that all of the omnivorous whole food diet patterns, whether from Scandinavia or from the Far East or from Central Africa, that it's very possible that all traditional whole food eating patterns will have similar benefits. Would not be surprising if we find that. It's just that the Mediterranean diet pattern is one that we have by far the greatest evidence for. And so it's a reasonable place to start. And in addition, it's a dietary pattern that most people kind of enjoy. It's not hard for them to adapt to it. And when we're talking to somebody about this in our office, we often have them complete a diet log for the last week or two, and we look at what they typically eat, and then we look at all their meals and their snacks and so on, and we say, instead of this, how about if you had this? Instead of having a boxed cold cereal that you put milk on, which are expensive, nutrient depleted, and tend to cause quite a striking rise in blood sugars, then why not have something that's a true whole grain, such as we actually have a combination that we use commonly that's 1/3 rye, 1/3 barley, and 1/3 whole oats. And these are true whole grains, right? They haven't been rolled or anything like that, haven't been processed in any way. And we cook them, you put some berries and some nuts with them. The starches in that combination are metabolized fairly slowly, so it doesn't tend, for most people with type 2 diabetes, it doesn't tend to be a problem. And so a small serving of that is a far better choice than cold cereals. And so we go through every meal and snack and find these substitutes that people will actually like, and we just keep working at it until we find combinations that they like. So in other words, we don't give people a canned package. People work out for themselves what are some whole foods that are better choices than the highly processed foods I'm currently eating. On the subject of highly processed foods, then it's worth knowing that the highly processed foods as a group in multiple studies are associated with pretty much every adverse health outcome that you want to avoid. So part of this whole idea is cook at home whenever possible. And remember that the combination that we're talking about here, the whole food Mediterranean style diets, are not just good for type 2 diabetes and prediabetes reversal and prevention. They're also good for reducing your risk of cancer and heart disease and stroke and dementia. This is a broad dietary pattern with a very, very broad application. And it's supported both from historical precedent as well as observational trials and randomized control trials. So whenever you hear somebody talking about diet, you always want to say, is this based on a theory or an ideology, or is it based on improving people's outcomes? And the way we do that in our practice is we don't make any recommendations that aren't supported by at least 3 lines of evidence. And the most typical pattern that we use is has it historically been something that people have done? That's the first line of evidence. Secondly, is it supported by observational trials? An example of that is the Nurses' Health Study, a gigantic trial gone for maybe 30 years, over 100,000 people in it. And thirdly, are there randomized controlled trials supporting it? And admittedly, randomized controlled trials are hard to do in the area of lifestyle. But the fortunate thing about the Mediterranean diet is that people like it enough that actually there are many, many randomized controlled trials showing its benefit. And remember that all of this is adaptable to your taste. Don't let anybody else dictate the fine points of your diet pattern. Go for whole foods you prepared at home, and as broad a variety as possible. There's lots of other details, for example, probiotic foods that we could talk about that are all important. And that's all, those greater details are available on our website, which is greatmed.org. One of the aspects to this to think about is just people that we've treated. And one recent case was a lady who had prediabetes and had kidney failure due to a very serious autoimmune disease. And so we treated her with the typical medications that we'd use for this disorder to protect her kidneys. And then we got to work on her lifestyle. And one of the aspects of that was doing exactly what I just talked about, getting rid of the refined carbohydrates, getting rid of the highly processed foods that she was eating. And she had a dramatic reversal in both the kidney failure and the autoimmune disease markers, as well as her prediabetes, meaning that she needed far less of the immunosuppressants that she was on, and she was able to stop them in weeks, when in actual fact, people with this disorder typically are treated with immunosuppression for a year or two, not uncommonly. And so when we think of her and how much she's been saved because of her better lifestyle choices, has been saved from the consequences of high-powered immunosuppressive therapy, which puts you at risk of all kinds of things, including cancers and tuberculosis, and the risks of high-dose steroids, which she was able to stop very quickly with appropriate supervision. This is not something to do at home, and so therefore saved her from. She almost certainly would have had significant osteoporosis, for example, if she'd followed our normal treatment protocol. The second thing is, even if you're making relatively good or extremely good food choices, a lot of people just eat too much. And one of the things we sometimes do is have people measure their food, which is kind of a drag, or take pictures of their food, so we can get a sense of what if they're not making good progress with weight management and blood sugar control. What is it about, if they're making good food choices and they're telling us the truth about their good food choices, why aren't they making progress? And often we just see people eating way more than they should. And so it's as a loose rule of thumb, if you need to lose weight, then you need to eat less than you're currently eating, even if you think you're eating hardly anything at all. And that's really a hard thing for a lot of people to realize. They've already cut back. They think they're doing really well, and in many respects they are, but they're still eating a little bit more than they need to. And remembering that if you cut your calories by a couple hundred calories a day, you're going to, from your baseline, then you're going to probably lose weight. And the niftiest trick we know of to eat less without being hungry is that before every meal and snack, you have a large serving of fruit or a vegetable. And that includes for type 2 diabetic patients. So for example, imagine, this is just an example. Don't take this as gospel. Just think of this as a pattern to adapt to your own circumstances. But imagine if you need to lose weight and every evening you made sure you had 6 apples. And then during the course of the next day, before you eat anything else, you had at least 1 apple. I can guarantee you that you will lose weight because you're simply not going to eat as much. You can't eat an apple before a meal and eat just as much as you would have otherwise. And people often say, but apples have sugar. They don't have much. If you can show me anybody who got chubby or developed type 2 diabetes because they ate too many apples, let me know. I'd love to meet them. You can do the same thing with carrots, celery, cucumbers, whatever you want, but it has to be a fruit or vegetable because we're looking for something that has very, very low calorie density, a lot of fiber, and is filling. If you're still hungry, so occasionally people do all this, they're actually making good progress, but they say, but Dr. Hassell, I'm hungry all the time. Then we throw in protein, cold meat, half a can of tuna, piece of cheese with their apples, whatever. Because it's protein and fat that are going to satisfy you under those conditions. What we want to avoid is replacing the need for calories because they're hungry with something with a little starch. So we don't want to, or sugar. So we don't want to throw a croissant into the mix, or a bagel, or you get the idea. When you're eating, in terms of quantity, always be asking yourself, do I need another bite? Or can I stop now? This is a really interesting rule of thumb, and was exemplified by an airline pilot I had. And he was pretty chubby, and he was likely to lose his position because of his weight. And so he did a fantastic job of losing weight very rapidly. And I said, of all the things that you did, what made the biggest difference? And he said, you know what? Every time I took a forkful of food, I looked at it and I said, is this worth losing my job over? And that's what it took to turn him around. So don't eat mindlessly. The third trick, so we've talked about food quality. We've talked about food quantity. Let's talk about physical activity. So physical activity, of course, in addition to helping prevent and reverse type 2 diabetes and prediabetes, helps every aspect of health. It improves your cognitive function. It improves your risk of heart attack and stroke. It improves your energy levels. It improves your hormone levels. For example, in males, it'll increase your testosterone level and lower your estrogen levels. Everybody feels better when they have a regular exercise program. I think that's a pretty safe rule of thumb. There might be a few of you out there that it doesn't apply to, but I haven't met you yet. So think of exercise every day, preferably more than once a day. And think of it as whatever you can do. Don't go by some gym rat's recommendation that you do an hour, right? If an hour is too much for you, it's too much for you. If 1 minute is about right, 1 minute's great. In fact, there's a book out there called The 1 Minute Workout that's worth reading. So the key about your physical activity, if you need to increase it, is increase it by any amount. And so typically our prescription for people that do not have a regular exercise program is 1 minute, 3 times a day. We like them to do something that's upper and lower body, like maybe a few dumbbells or an exercise ball or resistance bands or a skipping rope. Any combination they want to do, stairs, jumping jacks, pull-ups, push-ups, we aren't fussy. We'll take anything. We like a little resistance exercise with some weights if we can get it, but we're not that fussed. And by doing it 3 times a day, you appear to maintain a higher metabolic rate than you do with just once a day or a big exercise routine 3 times a week or something like that. So 3 times a day, at least 1 minute, and you're not exercising if you're not short of breath. So those people who go for a walk for an hour every day, that's fabulous to go for a walk for an hour every day. And often it's a great time to talk to your spouse or friends or take your dog for a walk. But if you're not short of breath, we don't think you should consider that exercise. That's recreation, and that's okay too. But if you really want to improve your health, do something that makes you short of breath. Do it more than once a day. We had a patient who he was getting quite a few side effects. He had a little bit of prediabetes, but more importantly, he had high blood pressure. And he really didn't like the side effects from the various medications I tried him on. And so he decided, we started talking over, and we decided probably somewhere in the region of 30 pounds of weight loss would probably take care of his hypertension, which it usually does. Not every case, but probably 90% of cases. So he got to work on it, and he improved his diet a bit and lost a little bit of weight and felt better, but he still had high blood pressure, was still on his high blood pressure medicines. All of a sudden, he started losing a pound or two a week. And so we said, what'd you do differently? And he said, high steps. And so I wish I would be in our studio environment here. It's hard for me to do high steps, but basically he would lift one knee and slap it with the other hand, lift the other knee, slap it with the other hand, and do that as fast as he could for a minute every hour. So it didn't take a lot of time. So a total maybe 8 or 10 minutes a day. When you do that, most of us get short of breath with just that simple activity. Try it right now if you can. Put me on pause. Doing some high steps is more important than listening to me. And it had fabulous results, and he's maintained those results for years. We still follow him, and he's in great shape and maintains his great shape just with that little bit of exercise. So one of the interesting aspects of one little research study that was done that looked at exercise and preventing and reversing type 2 diabetes and prediabetes was they looked at people who walked briskly for 45 minutes a day or 15 minutes 3 times a day. And the group that did the best were the group that did 15 minutes 3 times a day, even though on paper they had the same total volume of exercise. There's something about several times a day that makes a bigger difference. So recapping, don't be tied into any one system. Do something that makes you short of breath and preferably sweaty. Do something that involves your upper and lower body. Do it more than once a day, preferably 3 times a day. And if you need to, get an exercise buddy or something like that. Exercise buddies make exercise a whole lot more fun. Speaking of fun, maybe instead of an exercise like we've talked about, maybe take up tennis or pickleball or ping pong. Do something, do it frequently, and have fun doing it. None of this. The next step we're going to be thinking about is waist loss. None of this really matters too much. Well, yeah, I guess. Hang on. In the concept of all this, we also need to think about waist loss. So the goal for type 2 diabetes and prediabetes prevention reversal is not so much just changing your metabolism with food and exercise, although those are critical. We need to remember that almost everybody who has those problems needs to lose weight around the waist. Not everybody, but almost everybody. There are plenty of people who are slim and still have type 2 diabetes or prediabetes, and that's a separate issue that we'll deal at some other time. But the excess weight around the middle acts like an extra organ. It has all kinds of adverse hormonal effects. That extra fat around their middle is also reflected in extra fat in your liver and around your heart, and increase your risk of atrial fibrillation, liver fibrosis and cirrhosis, all kinds of problems. And as I said, really quite dramatic hormonal maladaptions. And so while you're doing all this, make sure that you're steadily losing weight. Somewhere around a pound a week is probably reasonable. We've never seen anybody lose weight too fast on a whole food diet with an exercise program. But make sure you're losing weight. If you're not losing weight, you need to change something. When people are not overweight and still have type 2 diabetes and prediabetes, we use the same system, and we've actually had a lot of experience with this, and it still seems to work. We work harder on muscle mass increase and metabolism, improving metabolism, and refined carbohydrate reduction. Although we don't have any good studies that have looked at this issue that we're aware of, in our experience in many patients who are thin with type 2 diabetes or prediabetes and very, very low insulin levels in their blood, in other words, they have very poor pancreatic function, then that group using the same system, we're able to keep them in great shape without needing medications, simply by using the same methods of good food, not too much of it, plenty of protein, avoiding refined foods and refined sugars and starches, and maintaining muscle mass. Getting your mind on board. None of this will work if you don't plan. Failure to plan is planning to fail. So remind yourself, why do you want to change? Do you want to feel better with more energy? Do you want to take fewer medications? Do you want to have fewer doctor's visits? Do you want to have less potential for medical complications? Do you want to have a better life 10 years from now than you would if you're just following a standard medical protocol? Do you want to have preventable disability rob your independence? Do you want to reduce your risk of heart disease and stroke and cancer and dementia? Maybe you've already had cancer and you want to reduce the risk of recurrence. The things that we've talked about all apply in these areas. So remind yourself why you want to change, and then probably every evening, plan what your new life tomorrow is going to look like. That means you have to have the right food around. You have to have the right timing, because none of this is going to occur unless you put some time and effort into it. And that usually means you have to put less time and effort into something else. We suggest starting with the television, and sometimes I'm known to drag a pair of bolt cutters into a room for theatrical purposes. And I demonstrate that if you pull the plug out of your television cord or your computer monitor and cut that plug off, then you can't turn those things on, and suddenly you're going to have more time to chop vegetables. And remember, this is not a diet for a short term. This is a lifestyle intended to give you better independence for the rest of your life. And of course, change is challenging. Just don't whine about it. Just do it. As the Navy SEALs say, the only easy day was yesterday. Finding a Health Revolution buddy is not a problem. Ideally, that's going to be somebody in your family. A spouse is perfect. But even if you can't find that buddy, do it on your own, and you'll find a buddy soon enough. I mentioned don't whine. You know, if you concentrate on solutions rather than the problems, and the things you can change rather than the things you can't change, life looks a lot better. We live here in the Pacific Northwest where it rains a lot. If you look out the window over to my over my right shoulder, it's probably raining right now. So we say to people, you can't use the excuse of lousy weather for not exercising. It's not even a nice try. It's just dumb. And here in the Pacific Northwest, there's no such thing as bad weather. There's just bad gear. So go down to Goodwill, get a rain jacket, maybe an umbrella, and get out there and do something besides splashing in puddles is really fun. And the Bible says, lest you be as little children, you shall not inherit the kingdom of God. And have you ever noticed how little children loves splashing in puddles? Forming new habits. So don't let your habits control you. I don't really care what your habits are when I'm seeing you in the intensive care unit with heart failure. I don't care that you had trouble getting over your habits. I care that you didn't get over them because now you're really suffering. So remembering that don't let your habits control you. And consider the alternatives. The alternatives are more medicines, more doctor visits, more disability, not feeling as good as you should be able to. Less likelihood of independence in 5 and 10 and 15 and 20 years, depending on your age. So go out there, kill it, Tiger. You can do this. The issues are good food, not too much of it. Good exercise habits that also involve something that builds muscle, something that you do more than once a day. Knowing what your goals are, considering the alternatives, finding the right exercise buddy. Don't let your previous life control you. Don't let your previous life define you. Remember why you're doing all this. And once again, the podcast is Walk, Don't Run to the Doctor. The website is greatmed.org. The book is Good Food, Great Medicine. It's available all kinds of places. And I'm Miles Hassell, MD at St. Vincent Hospital in Portland, Oregon. Thank you.